Good afternoon, everyone, and welcome to Fauci and Friends of Fireside Chat with Dr. Fauci, America's doctor, and DC healthcare leaders. Coming to the stage is someone who needs absolutely no introduction. I'm speaking of the mayor of the District of Columbia, the nation's capital, and the future 51st state, DC Mayor Muriel Bowser.
Well, good afternoon, everybody. I am so delighted to see you all here and so delighted to see you here in person. I want to welcome you to today's Fireside Chat. We are very grateful to be able to host an event like this in our community today. And as your mayor, it is, of course, my main priority to make sure that we crush this virus and that we can get back to our lives and so that we can get back to better than normal. We are grateful to the ARC and to Rasan Bernard, who is the CEO of Building Bridges, and we want to thank them for having us today. Please give the ARC a big round of applause. I would also like to thank everyone who has taken the time to join us here in Ward 8 for today's event. I have a great honor, and I think that we have a real treat in store for us today that will be both educational and so important to the work that we will do ahead. We've, of course, invited Ward 8 neighbors and community leaders, but also our community core, who is going to be going out door to door, talking to residents about how they can get their free life-saving vaccines. We are also going to have a wonderful panel of medical leaders in Washington, D.C., including our own doctor, Dr. Nesbitt. But before we do that, I have the opportunity to introduce and to chat with for a few minutes before he goes on to his other work of the day, the director of the National Institute of Allergy and Infectious Diseases at the National Institutes of Health. And that, of course, is our fellow Washingtonian and America's doctor, Dr. Anthony Fauci. Good afternoon, Dr. Fauci. How are you? Is Mayor Bowser
Good afternoon,
here?
Madam Mayor. I'm fine, thanks. How are you?
I'm doing great, and I want to thank you not only for taking the time out with us today, but for all of the other times that we have called on you for your advice and your leadership with the nation's directors of health, including our director of health, Dr. LaQuandra Nesbitt. We are at the ARC in Ward 8. We are joined in person by dozens of Ward 8 residents, leaders in our community core. They're going to get to hear all of the tough questions I ask you, but then they'll also hear from a panel of DC experts. So first, Dr. Fauci, let me just say, early on in the pandemic, I had never met you. And I heard many interviews that you did, and I learned that you are a DC resident. So tell us why you made the very smart decision to make your family right here in Washington, D.C.
Well, I was born and raised in New York City before I came down here. The first 28 years of my life, I lived in New York City. When I moved to Washington to work at the NIH in Bethesda, I was completely unaware of the extraordinary assets of Washington, D.C. I always wanted to say, I'm going to go back to New York. This is just an interim thing for me. Then I got to know the city. And I actually think, and I'm not saying this just because you're our mayor, that this is the best city in the world.
Amen. Amen,
I mean,
brother.
it really is. It really is. It is because it's vibrant, it's diversified. I like that. It's physically beautiful. There's green around. I live in Northwest DC. I can get down to the canal in about 10 minutes of jogging, and we'd be essentially in a beautiful nature wonderland for an hour before I get back to work. I can be downtown. I could be at the White House. There's nothing better. It's just a beautiful city, and its inhabitants are extremely welcoming. I love it.
Well, good. We're glad you love it, and we love you too. And you mentioned something that you've been known for as well, and that's staying healthy. On December 24th, we declared that Anthony Fauci Day in Washington, D.C., and it was also a very special birthday for you. And I think if you didn't tell people which birthday it was, they wouldn't know. So what is your, how do you stay so fit and vibrant and going to work every single day?
Well, I think there are several things. One is exercise is something I do every day. And I just would encourage everyone to the extent that they can do that. I'm a runner. I've run in the Marine Corps Marathon multiple times, the New York Marathon 10Ks. But I think it's also the passion for what you do to keep you excited about getting up in the morning and going to work. And it doesn't necessarily mean you have to be a physician or a scientist, anything you do. If you get excited about what you're doing and you're making a contribution in some way or other, that really keeps you vibrant and young. So I think a combination of living healthy. I don't do things in excess. I don't smoke. I don't drink very often at all. And I exercise a lot. And I have a very supportive wife, which is really good.
Fantastic. Let's hear it for all the very supportive wives. Give them a big round of applause. So, Dr. Fauci, let me jump into why you are here to talk with us. You are trained in internal medicine, and you've spent your career researching and fighting infectious diseases, including HIV and AIDS and Zika and Ebola. And the coronaviruses. So tell us why COVID-19 is so different. If it is so different, it certainly seems so different to us. What's different about it, and how are we doing in our fight against it?
Well, it's really very different in so many respects. When I've gotten asked over the years what my worst nightmare was and what keeps me up at night, I would always say it was the emergence of a brand new infectious disease that the world has never seen before. That's a respiratory virus that has two major capabilities. One, to transmit extremely efficiently from person to person, and to have the capability of a high degree of morbidity and mortality. And unfortunately, we are now living through that worst nightmare, because we've had the worst pandemic that the world has seen in the last 102 years, 103 years, since the infamous and historic pandemic of influenza of 1918. That puts it unique in history. So although it is painful for us, we are living through history right now. This is the worst the world has seen in over 100 years. And that's the reason why we have to take it seriously. It can be a little bit confusing because it's already killed 590,000 Americans and made many others very sick. But yet in some people, it doesn't have any symptoms at all. So it's a very perplexing. It might fool you into being complacent that it's not serious. How have we done? Well, from a scientific standpoint, we are very fortunate that the investments in biomedical research for the previous decades has allowed us to develop very quickly multiple highly effective and safe vaccines, which are life-saving. We have vaccines that are 94 to 95% effective. We have more than one. We have 3 vaccines that are life-saving. And as a nation, we're doing pretty well in getting people vaccinated. The district itself is doing really well. You have about 58% of the residents are partially or fully vaccinated. About 48% are fully vaccinated. The only issue, Madam Mayor, is that we've got to do better with younger people, because our younger people who can understandably feel that they're invulnerable usually are not enthusiastic about getting vaccinated. But they've got to realize that not only do they need a vaccine to protect themselves and their family, but we've got to protect the community. So if you're protected, you don't allow the virus to spread to another person. So you're doing twofold things. You're protecting yourself, and you're preventing the virus from using you as a vehicle of spread. And that's why we've got to get people vaccinated, particularly our young people.
Well, that's a great point that we want to drive home with all our community organizers in the room as they're going door to door in Washington, D.C., talking to people about why it's so important to get vaccinated. We are, of course, going to focus in our communities in Ward 7 and 8 with our door knocking, Dr. Fauci. Can you talk a little bit about why this virus has been so fatal for African Americans?
Yes, and that is really a very painful reality of this virus. First of all, given the nature in which African Americans have jobs, many of those jobs are essential to the running of society. So they're out there. They're not behind a computer most of the time. Some are, but many are out there getting exposed, which means they have a higher incidence of getting infected. Once they get infected, they have a higher likelihood of a severe outcome, hospitalization and or death. And the reason is that African Americans have a higher incidence and prevalence of the underlying comorbidity medical diseases that allow you to be more likely to get a severe outcome. That's diabetes, hypertension, obesity, chronic renal disease, chronic lung disease. Those are not things that are racially determined. They are the result of the social determinants of health. The situation that African Americans find themselves in from birth, through no fault of their own, lack of access to proper diet, lack of access to health care, to pick up things like hypertension early so that you can treat it. So I've always said, Madam Mayor, one of the things that I hope the experience of this outbreak shows us is that we've got to commit as a society to eliminate, and it's not going to be overnight, to eliminate those disparities by providing for African Americans all of the access that they need to the kind of health care, diet, all the things that keep people healthy. As I said before, that is an undeniable result of years and years of racism, which have actually led to these social determinants of health. We've got to address that.
We've definitely got to. And I know I've heard you speak many times about those social determinants and how you've made your life's work also addressing them. We think we have some good ideas in D.C. that we're putting in place to overcome decades, if not centuries, of where we are. And that is that people on one side of our city live much longer than people who live on the other side of the city, and we have to close those gaps. And so we're doing things like investing in more affordable housing. We know that is linked to healthier people. Investing in having more good food stores in all wards of the District of Columbia, making sure that our young people and residents are insured. We boast one of the highest insured rates in the nations, but we also want to make sure people are connecting to their primary care physicians. So, Dr. Fauci, will you help me? I'll try to go quickly with this one. For those of us who are out in the community, and will be more in the coming days, talking to people about getting vaccine, you've probably heard every reason that somebody doesn't want to get a vaccine. And I'm wondering if you could help us with those responses. I've heard people say, I don't want to get that vaccine because it took them, they didn't take long to develop it. It happened too fast.
All right. The answer to that is easy, Madam Mayor. The answer is the virus was discovered in January of 2020, and we had vaccine going into people's arms, a highly effective vaccine in December. That's 11 months. That is indeed the fastest in the history of any vaccine. But that wasn't rushing. What that was the reflection of the decades of basic and clinical research that antedated the development of the vaccine to allow us to hit the ground running. So we're very fortunate that we live in an era where we're reaping the rewards and the fruits of multiple years of investment in research. So we didn't rush it at all. It's just the manifestation of an investment in research.
So what do we say to people who say, I don't want to do it because Donald Trump was involved and I don't trust Donald Trump?
Well, we're not asking you to trust Donald Trump. I mean, we're asking you to trust the medical establishment. And the medical establishment, myself and my colleagues, thousands of us, thousands, not just me, feel very strongly that it is so important for your own protection and that of your family and your community to get vaccinated. Keep politics out of this. This is a medical issue. Whether you like or don't like a politician is irrelevant. This is a medical issue.
And what do we say to the people who said, well, I haven't gotten it at all this time, so I'm probably not going to get it?
That's a dangerous assumption, and it relates to what I said before. We have seen the devastating effects of this virus. It's killed 590,000 Americans. That is extraordinary. That is something you need to take very seriously. But also, as I mentioned a moment ago, even if you don't get sick from getting infected, you could inadvertently and innocently be a vehicle to transmit it to a person who has an underlying condition. That could be someone's mother or father or wife or husband who might have an underlying condition, or an elderly grandparent. You don't want to do that. I can't imagine anybody would want to deliberately hurt someone else. The way you can prevent yourself from doing that is to get vaccinated so that you don't spread it to someone else.
Thank you. And what about for our little people? 12 and over, the vaccines, or at least one vaccine is approved for kids 12 and over, and the parents who are reluctant because they think that this may be some experimentation on their kids. African Americans are frequently reluctant because of the history of experimentation with African Americans. What would you say to those families?
Well, I think you'd have to just look at the facts, Madam Mayor. This is not an experimentation. There are many, many more white people getting vaccinated than there are African American. So I don't understand how you can come to a conclusion that getting a vaccine for an African American is experimenting on them. I mean, I got a vaccine. The president and vice president got vaccinated. We all got vaccinated. This isn't an experiment. This is an attempt to preserve your health. So we've got to get it out of the realm. There was a time, a shameful time, many decades ago when the federal government did not use ethical principles in how they treated African Americans in medicine, the infamous Tuskegee experiments. That will never happen again because the ethical constraints that have been put in place would never allow that to happen. There's no experimentation here. There's an attempt to preserve public health.
Fantastic. And what what we have experienced in the district, Dr. Fauci, is when the vaccines became widely available, sooner than we thought they would, we were able to pretty much open up all of our categories for vaccine in mid-April. And by early May, our incident of infection plummeted. It literally plummeted. We were able to largely reopen the city on May 21st and fully open the city today without capacity restrictions. So we're very, very proud of that progress. And the other thing that I know that our families are hesitant about is school. We have worked extremely hard to reopen our schools beginning in February, but there's still gaps in families who are confident in going back, and there's a racial divide there as well. Can you talk to us about getting kids back to school, and what's your assessment?
Well, I believe strongly that by the time we get to the fall term, that we will have complete in-person teaching of children in the context of the classroom. Because by that time, we will have the overwhelming majority of the teachers will be vaccinated. High school kids will be vaccinated. The level of infection will be so low in society that there will not be a problem with schools. I fully expect that the District of Columbia will be fully open for in-person schooling for the next term.
Yeah, well, I fully know that the District of Columbia will be open 5 days a week in person for every child. And just like today, your beloved Washington Nationals can open fully our restaurants and bars and entertainment facilities, and we're in a beautiful theater now. And I know that they are eager to get back to work as well. So, Dr. Fauci, we wanted to thank you for coming to talk to us. I know this is going to be a valuable chat for our community activists and workers who are assembled here who are going to be talking to DC residents. While we think we are doing well with vaccine, we know that we could be doing better. We're grateful to our employers who are also pushing vaccine and getting their workers back to work. So thank you for your work on COVID-19, on HIV and AIDS, and thank you for just being a wonderful DC resident. Have a great one.
Thank you very much, Madam Mayor. Thank you for having me. It's a real pleasure. And by the way, I've worked very closely. You have a really terrific director of your health, LaQuandra Nesmith. Yeah. She's become a good friend. Good. And she's really terrific. So
thank you.
Way to go.
Thanks, Dr. Fauci.
All right, take care. Bye-bye.
So now, as we transition to our panel, we want to show you a video about our outreach efforts to let every DC resident know about the COVID-19 vaccines. We cannot get back to life until we are vaccinated. We've driven our numbers way down. I mean, we are crushing this virus, but people are still getting it and people are still dying from it. So please go get vaccinated.
Good afternoon. I'm Denise Rollard Barnes, publisher of the Washington Informer newspaper, and so happy to have with us
James Wright. I'm a reporter with the Washington Informer.
And our panelists, Dr. LaQuandra Nesbitt. I'm sorry, I got to check my notes. Dr. Kurt Newsom from the Children's Hospital, and Dr. Shelley McDonald Pinkett from Howard University Hospital. So glad to have all three of you with us. And glad to have all of you all with us as well. We're going to start off, James and myself, asking some questions, but know that you will have an opportunity to ask your questions as well. We're going to save some time for that. So let's get the ball on the road. James, you want to start?
Yes. Thank you very much. Dr. Nesbitt, you have worked since the advent of this pandemic in mid-March, literally nonstop, in order to try to control the virus in the city. Could you just talk a little bit about your experiences with that, and how do you feel district residents have responded to what the mayor was just talking about in terms of fighting this virus?
Sure. Thank you so much, James, and thank you as well, Denise. It's so good to be here with both of you who have also done a remarkable job during the pandemic to make sure that our communities were informed and had the information that they needed. There's no way anyone can say that they were fully prepared for every single thing that happened during this pandemic. At DC Health, we've been laser focused on emergency preparedness since I've been here in 2015. We have exercises and we have drills, and we partner with our hospitals and our long-term care facilities to figure out our best plan of execution if something happens. But as Dr. Fauci mentioned, this emerging infectious disease was much different than anything that we had experienced in the past decade or so. I was in DC during H1N1, here for Zika, and this was just a radically different pathogen or virus. And what it required was for us in public health to provide recommendations, to provide guidance, to always be transparent and honest about what we knew and what we didn't know, to continue to monitor the data so we were making the best decisions and giving the best advice to our leadership. But it also required people, everybody, to make commitments and sacrifices in very different ways. And it required people to not only think about themselves, but to think about their neighbor. And I think the residents of the District of Columbia, the workers of the District of Columbia, our businesses, our employers, everyone deserves a tremendous pat on the back for the amount of commitment they put into helping us flatten the curve and crush the virus. Without all of the things that every resident did that we asked them to do, we wouldn't be in the position that we are today.
Thank you, Doctor. I'm going to throw a question out actually to all three of you, but I'm going to start with you, Dr. Nesbitt. And I guess it's almost as if we are here celebrating today, and the elephant in the room is the news we've been hearing as of this morning. And so the question is, we're celebrating the fact that the city is opening, but we're also seeing some signs that don't look so good. There are people who've been vaccinated that have reportedly are continuing to get the COVID, showing signs of COVID on cruise ships. Dr. Newman, there's a report that children that have been vaccinated are having some heart problems. And Dr. Pinkett, how do you prepare for a pandemic that it seems as if it's over, but it's not? How do you stay prepared? So I'll start with you, Dr. Nesbitt.
Sure. This has been a question that people have had for since we got our first vaccines in December is, will they work? And we know that vaccines, when in their clinical trials, as Dr. Fauci mentioned, were 95% effective. Now, there's something that happens after the clinical trial, and this is for everything, not just vaccines, all medications, any pharmaceutical. There's something that happens in the post-marketing phase of it that we try to see if it works in the real world as well as it did in the clinical trials. And we know that these vaccines have a 91% chance of reducing an individual's likelihood of getting COVID, hospitalizations, and almost 100% likelihood of preventing death. for a fully vaccinated individual. Now, because none of those numbers are exactly 100%, it is likely that people can have a breakthrough infection. The rates of breakthrough infections in the U.S. with the vaccines that are approved is less than 1%, and it's less than 1% in the District of Columbia. We also know that when people have a breakthrough infection, they're less likely to have symptoms. They're less likely to have a severe form of the disease that would end them in the hospital, and because of that, they're far more likely far less likely to die from COVID-19. So don't be discouraged by any news that you hear that a vaccinated person was diagnosed with COVID. The first question you want to ask is, were they fully vaccinated? Because that's 2 weeks after you got your final shot. And then if they were, you can ask a little bit more about that individual in terms of what their actual health status or experience with the virus is. And then lastly, we know that people who are vaccinated are far less likely to transfer the virus to other people. So this is something that you're not only doing for yourself to protect your health, but you're doing for your neighbors, you're doing for all of our children who are 11 years old and younger who cannot yet be vaccinated, and you're doing it for people who may be medically or immune compromised and where the vaccines may not fully protect them. So it's a tremendous thing that you can do for your community and for our society to get vaccinated.
Thanks. Sure, Dr. Newman?
Well, thank you, Denise, and thank you to the Washington Informer for bringing us all together to talk about these important topics. I don't think anybody's really truly declaring victory. I mean, we've seen success, and when you're dealing with children, I think we still have a long way to go. And my colleague here, and I can tell you, and I just want to say this, having a mayor like we have, and having the head of the DC Health like we've got, that's why we can feel so good right now and we can open up. It's leadership. And Washington, D.C. should be very proud of where we are compared to a lot of other cities. And then you look around the world and we can feel better and safer having these leaders look after us. I can tell you it was with Dr. Nesbitt, would bring the CEOs of all the hospitals together and all the community health folks and the doctors, and we'd meet regularly. So just a little story, with kids, we were waiting for the CDC to say when we could start vaccinating kids that were over 12. And we found out on a Wednesday night that they were going to approve it. By Thursday morning, Dr. Nesbitt had us the vaccines at Children's Hospital that next morning so we could start vaccinating the 12 and up. I think we were the first in the nation to be able to do that. So you just think about that type of leadership. And it's a pleasure to be here, too, at the ARC with Rasan's being a great host. And when you go out the front door, you'll see our big Children's National Clinic over there. That was where we brought the first vaccinations for the 16 and up when we were able to do it, because we felt that this community here had the greatest needs for the children to get those 16-year-olds, because like the mayor and Dr. Fauci said, we want to get those kids back in school. We want them to be able to feel protected and healthy. We wanted those teachers, and we're running clinics at Dunbar and Ballou to make sure that the kids are ready to go back to school. The one thing I worry about, and I'll get to the situation you talked about, that I worry about, though, is not just getting the kids vaccinated for the COVID-19, but we're falling behind on our regular vaccinations. And these are serious diseases that we've kind of forgotten about. You know, people declared victory against polio and measles and all these other things, but it's not far away that they could come back. And if our kids aren't vaccinated, and we're seeing very disturbing signs that people are not getting their kids vaccinated before they, we're not going to be in good shape when we get back to school. So we've got a lot of work to do ahead of us. And then the point that was made before, the under 12, the vaccines still have not been fully studied. We're part of a big study of the Pfizer's vaccine, 100 places across the country. But that may take, Dr. Nesbitt, into the fall before we know. So there's a lot of kids that'll be in school that aren't vaccinated. And at our hospital, there'll be a lot of children that are coming in that aren't vaccinated. That's why this week, with Dr. Nesbitt's help, we made a bold statement with a lot of the other hospitals in this area to say we are going to make vaccination mandatory for our healthcare workers. Thank you for that, but that may seem a little controversial to some people. But I don't know a mother or a father or an uncle or a grandparent that would want to bring their child to a hospital where they didn't know that everybody that was going to take care of that child was vaccinated, particularly since the child wasn't vaccinated. So that's the kind of thinking that we're doing. Now, is every vaccine, and every treatment, as you go into it, as Dr. Nesbitt said, you start learning some things, and you've got to figure out whether that was something that's related to the vaccine or whether it was something that just happens naturally. And we're seeing a few things in kids where, particularly, I think it's young males, where after the second vaccine, there's been reports of, and it's a very, very small number in the 10s to 20s, I think, at this point, where they've had some chest pain and fever, and they've all recovered. But it's something we need to continue to keep our eye on because, it's when you're dealing with the heart, you never want to take any chances on that kind of thing. But if you lay that out against all the people that have died or been made very sick, and one of the disturbing trends, Denise, we're seeing right now is, and Dr. Nesbitt may want to talk about this, is more and more younger people are getting really sick. Is this a new variant? And just what's going on? So, again, I guess my theme here is we don't want to take our foot off the gas. We're making progress. Maybe the finish line's there, but we want to race hard to the finish.
Thank you, Dr. Pinkett. I again wanted to get a sense of what you're seeing at Howard and are children being brought in for vaccines and just what's the situation there at the hospital?
Thank you very much. And I'd like to join my colleague in praising the leadership of the District of Columbia for the work that's been done thus far. What is a challenge to me as the Chief Medical Officer at Howard University Hospital is seeing those patients who are coming in who are unvaccinated, unfortunately, and seeing that their sometimes lives are being lost or that they are very, very ill. So I certainly join my colleagues in recommending that everyone be vaccinated. It is the younger age groups that we're seeing coming in now who are requiring ventilation and life support to reverse these illnesses. So we continue to recommend vaccination for everyone. As far as the children, of course, my colleagues at Children's National are the experts on those, but we at Howard are also vaccinating our pediatric population. The other thing I'd like to say is that we have certainly joined all of the District of Columbia hospitals in recommending that all employees of the hospital are vaccinated. I'm proud to say that our physician staff and our house staff, those physicians in training, are about 90% and above in being vaccinated, but it's not 100%. We still have our nursing colleagues that are increasing their vaccination rates, but need to do more. The other workers in the hospital are frontline workers. Those are, our folks who are in EVS, that's our housekeeping staff, our respiratory therapy staff, our administrative staff. The vaccination rate is much lower. And so we at the hospital are continuing to encourage them to become vaccinated. I'll tell you just a really brief story, but it's not as pleasant and maybe as you'd like to hear, but it's really disturbing to have people come to me and an administrator come to me to say that my 39-year-old niece is ill, has had a heart attack, and required ventilatory and life support because of COVID-19. And we know, based on what Dr. Nesbitt has said and the work that Fauci and others have done, that that is completely preventable. May she still have contracted COVID-19? Maybe. But how severely ill will she become if she'd been vaccinated? And that is where we're trying to get everyone to understand. We know that we must go out into the communities. We know that we must develop trusting relationships with those in the community so that you'll understand what it is that the scientists are telling us. So I'll stop there, but please know that vaccination is the only way and the only thing that we have right now to prevent illness. There are medications, of course, to treat, but we want to prevent everyone from becoming ill. Thanks for the question.
I just want to lay it down on the line here. I talked to a lot of African Americans during this pandemic, and the reason some who are uneducated don't want to get vaccinated is because they cite the Tuskegee experiment. And then there are some who have this wild idea that the vaccinations have a microchip, which is a part of 666 and the Antichrist and that sort of thing. And then you have some who even, and Dr. Nesbitt, you and I have talked about this, who tend to discriminate in terms of the vaccines. I was covering a story at Turkey Thicket a few months ago. Young man was in line to get the vaccine. And then when he got to the table to be processed, he asked which vaccine they were administering. And they told him it was the Johnson & Johnson. He said, "Thank you, goodbye," and he left. And the perception is that the Johnson & Johnson, because it's one shot, is inferior to Pfizer, BioNTech, and Moderna. Could you address those misconceptions, Dr. Nesbitt and the other doctor leaders, about why it's important for African Americans not to think like this?
Sure. And, James, it's an excellent question. And, none of us are new to health. None of us are new to population health. And none of us are new to trying our best, I was almost going to use a stronger word, to eliminate disparities in health and health inequities. So it has been very disturbing to us throughout the pandemic to watch that the rates of infections in D.C. residents, Black D.C. residents, and Latinx D.C. residents at many times exceeded their proportion of our population. And I think everyone knows that there has been about 75% of our deaths, 3 out of 4 of the deaths that have occurred, the 1,100 or so Washingtonian lives that have been lost, have been Black folks, right? So we cannot afford as a community to buy into myths that are designed. It's the myths that are designed to harm the Black folks. It's not the vaccines that are designed to harm the Black folks. So when you think about, this is a vaccine that the world wants, the entire world. If it was a vaccine, as Dr. Fauci said, that was intended to harm people of color, we wouldn't be giving it to everyone. There's no difference when we pass out the vaccines to Children's and Howard and Sibley and UMC and all of the pharmacies around town and our federally qualified health centers. We don't separate batches to say these are good enough for the folks who go to Sibley, these are good enough for the folks that go to UMC, okay? Everybody's getting the same vaccine. And James and I had this conversation about the Johnson & Johnson vaccine very early on, and we like that vaccine. That vaccine is effective, it's safe. We know that there are some people who only want 1 dose of a vaccine, and Johnson & Johnson is great for that population. If you're not going to come back for a second dose, it is great for you. And it's difficult to compare the Pfizer and Moderna vaccines to the Johnson & Johnson vaccine in terms of looking at the clinical trials information, because they were all done at different times. And you all will note that the pandemic doesn't even look the same month to month.
around the world. So you can imagine that a clinical trial that happened later was dealing with a different environment. The other thing with Johnson & Johnson, it happened in more countries. Those clinical trials happened in more countries, and they happened in the diaspora. So it's important to note, when you're making these decisions, we want people to make informed decisions, but we want you to be clear on all of the things that you're hearing and not piecing things together. So again, a lot of these myths around microchips, I've heard the 666 thing as well, I've heard infertility, you name it, I've heard it. Those are the things that are designed to make you sick. It is not the vaccine that is designed to make you sick.
James, thank you. An important question, and I don't have too much to add on what Dr. Nesbitt said, except that to acknowledge that there are those myths out there, we've got to deal with them, and we've got to deal with them up front. And I think that's why the approach is to get trusted leaders, people from the community, to be in an audience like this is so important. That's why part of our strategy and tactics was to be in Ward 8 to deliver the vaccines here with the pediatricians that the community has grown to know and love, whether it was at our emergency department down the road at United Medical Center, or across the street here with this clinic, or in downtown Anacostia, or at Ballou, or with our mobile health, taking it to the community. We can't sit back and on something like this, and that's where Dr. Nesbitt and her team have been so good at looking at creative ways and places to get to people. But it's not, we got to keep working on that because we can have all the vaccine in the world, and if we're not getting it into the people, it's not doing any good. Just one further note on the Johnson & Johnson. When you think about kids, sometimes the shot is the problem. And so if you only have to do one, and once they had one, they don't want to come back for that number two. So that's been a real effective thing, or will be an effective thing when we can get that. It's still not approved for the younger patients. So we're still, have that 2-dose down to age 12.
So I'll comment by saying I grew up in our sister city, Baltimore. But I've been practicing here in the District of Columbia, which I love, for 30 years or more. But at any rate, that is to say, I have heard every sort of myth related to these vaccines sent to me from family, from friends, from my patients here in the district, and just from all around. But what is most important is to make sure that our community leaders, that our health leaders, and our religious leaders really understand these vaccines and can explain them to their constituents. What's really concerning to me, and that I heard, is that some of the religious leaders had informed some of their parishioners that the vaccines were not good and that they should not get them. I don't know if any of you have heard that. But at the same time, some of these leaders themselves have gone out and gotten vaccinated. So we really have to be careful about what you're hearing, what the source is, and then understand the source of truth. And the source of truth for me and those who are a part of this panel is what the science says and what it really demonstrates as far as saving lives of people in our community. I heard you mention Tuskegee. I'll tell you, I have heard that from professional people, but the people who are generally our patients very seldom mention Tuskegee. They may not even really know about Tuskegee. Perhaps they do. I'm not saying they do or don't. But what they will know and hear is what's in the social media, and that's the chip and the infertility. And so those who reach out and have the ability to communicate in a way that everyone understands need to work continuously to dispel those myths. Thank you.
Thank you. So let me remind everyone, if everyone in the audience has an opportunity to ask a question, well, not everyone, but people in the audience have an opportunity to ask a question. If you have an index card, please make sure you put the question on the card and someone will come and get that. And yeah, just raise your hand so that that card can be picked up. I just wanted to ask also, over the last few years, healthcare or health advocates east of the river, Ward 7 and 8, have almost sort of forewarned or foresaw, a situation such as this, where this community may have been caught short, or they thought would be caught short because of the lack, as the mayor made very clear, the lack of access to health care, and also the disparities that exist. This is not new to the residents of Ward 8, and when the pandemic occurred, it seemed as though this was the community that was really going to be greatly affected, but without the resources. Of course, you all have spoken very clearly about what was provided, but Howard Children's Hospital, I wanted you to talk a little bit about your recognition of what is happening in some communities and how you all are trying to better serve those communities, so that not only are we talking about COVID, as the mayor talked about, but all the other pre-existing conditions that exist in this community, and how you're helping to address that.
Well, I'll start, thank you, by saying that Howard has historically tried to work with the members of those communities that you mentioned, either formally or by training residents who, training physicians who actually have come to work in those specific communities. I know that we've partnered with Unity Health Center to provide services at our Benning Road clinic. So recognizing the health disparities that exist now and previously, we've always been a resource to work within those communities.
I think that's such an important question, and it's so important to raise that question here, where we are. And in the pediatric world, we have seen over the years the issues of the disparities of care and what was happening in the social determinants that Dr. Fauci mentioned, and the almost or over half the children in the District of Columbia live in Ward 7 and 8. So Children's National, we felt like we just couldn't be a hospital in one place. We had to be wherever those kids are and deal with the problems that those children have. And that means working with the community, working with partners, working with DC Health. They've got a totally robust strategy and looking at what the health needs assessment. My colleague Tanya Kinlow is here, runs all the government, community affairs, and advocacy for Children's National, lives in Ward 8. So we feel like we're part of the community, but it's embarrassing sometimes to see some of those health disparities. And we've got so much work to do. And the pandemic just piled on. It just made the problems that were there, whether it was nutrition, whether it was education, poverty, whatever the issues were exacerbated way more than other parts of the city or the region. One of the things we haven't talked about yet, where that has in the most intense, is around mental and behavioral health, and particularly of our children. The stresses that were already there on families and in the community, we're seeing play out. And kids aren't in school. They're not with their coaches or their teachers. They're not with their friends. They're isolated. And the rates of depression, anxiety, suicide, eating disorders are off the charts, and we're already behind in the resources to take care of those kids. So and there's not a vaccine for those issues. I mean, these are issues that are going to be with us for a long time. So that's troubling. Fortunately, we've got Howard, one of the great medical schools and universities and hospitals. We've got people like Dr. Nesbitt looking at this and all the other universities and medical schools. I'm really proud of the mayor, Dr. Nesbitt, and the council for insisting on a hospital on this side of the river. That's huge, and Children's will be part of that. But you know, it's more than hospitals and doctors and nurses. It's really these partnerships where we can tackle these tough problems. Thank you.
If I may, I just want to add something to this as well. And I first came to D.C. in 2008. And at that time, many states were trying to figure out what to do with something called tobacco settlement money. And this tobacco settlement funds in the district were invested extremely wisely back in 2008, 2009, with the intent to improve access to health care. And I'm often very surprised by the number of people I encounter who still believe we have the same health system in 2021 that we had in 2000, despite all of these investments. The district made historical investments, over $45 million, in improving the capacity of all of our federally qualified health centers and health centers in the District of Columbia. They take care of folks regardless of their insurance status. They are known for providing culturally competent care. So we have to be mindful and remember that we go to the hospital last. Our health starts in our primary care facilities in terms of maintaining our health. Another part of that investment, as Dr. Newman has mentioned, was bringing a pediatric emergency room east of the river to United Medical Center. And that is the commitment that Children's continues to have a presence even when we transition to the hospital on the campus of St. Elizabeth's. We often are the reason why people believe they don't have access to health care because it matters how we talk about it. I run into people who don't know they can get a mammogram at Community of Hope's Conway Center. It's been open for years, and it can serve so many more people than it's already serving. So we've got to be very intentional on our messaging that as we move into another phase of healthcare access in the District of Columbia, that people will actually utilize the services because we've talked about them enough for people to know that they exist. We're always going to be committed to quality of care in the District of Columbia. We're always going to do what we can to protect our residents to ensure that every healthcare facility that operates in this community is providing safe and quality care that is not only efficient but is equitable, and that it provides not only culturally competent services but culturally appropriate and acceptable services. And you'll see even reflected in this budget. Now, we had a pandemic budget that lots of stuff we wanted to do couldn't be done, but the mayor had commissioned a healthcare transformation commission. Every hospital CEO was on there, all the health plans were on there, and we produced a report at the end of December 2019. Those investments still happen despite changes in the economy. It means that we are committed to improving health access with a focus on equity. And you'll see even more investments in FY22 that begins in October to those same things. But we have to work collectively as a community to change perceptions that people have about interacting with the healthcare center. We can train all of the physicians we want to. We can pipeline all of the nurses that we want to. They should be coming from the community. They should be relatable to patients that they're taking care of. But if people won't touch the system, we'll remain in the same predicament.
I appreciate that, Dr. Nesbitt. I think one of the things you said that's really key is when you said we go to hospitals last. And many in our community go to the emergency room first, and so we have to change that. James?
Questions from the audience? Okay, we're going to start a question from Philip Pinnell, the Executive Director of the Anacostia Coordinating Council. When I talk with people who are reluctant to take the vaccine, they generally, and I have to turn over the card, ask, what is in it? Can the physicians please give a brief, clear answer to this question using language that lay people can understand?
Now, Phil, that's a tough one. Because the first thing that came to my mind was to say there's no virus in it. There's no active virus in it. But there's a protein in it, right? And so when you say that lay people can understand, I think we make a lot of assumptions about people understanding proteins and things of that nature. So at this bottom line, and we've got a cute cartoon infographic that we'll make sure all of you have that explains this, is that the vaccine goes in, it's not active virus, so it does not make you sick with COVID-19, okay? It cannot do that. But there's a protein that can help your body produce what are called antibodies that we need to fight off any infection. So whether it be a virus or a bacteria, whatever it is, we have to develop a response to it with the production of these antibodies. So what the vaccine does, and the Pfizer and Moderna vaccines act differently than the Johnson & Johnson vaccine, but it triggers your body to recognize the vaccine and say, hey, we should get ready just in case SARS-CoV-2 comes into this body, produces some antibodies so that you won't become sick with the infection.
And I'd like to say it just a little bit differently, but just based on the cartoon that Dr. Nesbitt referenced, that's a very nice cartoon. So the way that I explain it to my patients is that the vaccine is like, tells your body, pay attention. So when this comes the next time, your body's ready to fight it off. That's the way I explain it.
And I'm a surgeon, so I'll let the two doctors. But it's good. Let me just tell you that.
I have a couple of questions that really ask about other health conditions that might, whether the vaccine is safe for them. For example, if you have liver disease or kidney disease, or you're suffering from lupus. I mean, if there are other pre-existing diseases, will the vaccine be effective or harmful? What do those folks need to know?
Yeah, so I did a panel once with Dr. Kizzy. I think a lot of people know Dr. Kizzy Kizmekia Corbett. She's one of the folks at the NIH who had done years of research on mRNA vaccines and led a lot of the efforts for the Moderna vaccine. She says whenever you get that question, is the vaccine okay or safe or good for it, the answer is always yes. There's no describing it. The answer is always yes. What people may hear is that some people with certain chronic health conditions that cause their immune system to not perform or function as well as everyone else's may not create the same responses as Dr. McDonald-Pinkin mentioned, that the second time you see it, you can recognize it and create a response to it and fight it off. Just because you have those conditions doesn't mean that you're immunocompromised. Okay, those are two different things. So it's important to know that there are a lot of people who have some chronic health conditions that get the vaccines. They work just like they do in someone who doesn't have a chronic condition. But for people who don't produce these antibodies to fight off any type of infection, then they may have some challenges with SARS-CoV-2. But it's worth it to get it.
I just wanted to say back to the question about the explanation. So a lot of children have questions been coming from the audience. And if you want information to be able to explain the questions that the children are having, it's on the Children's National website, has the FAQs that you could use to help put it into the at the level that the child might understand.
I have a question. As the city fully opens and COVID is left far back in our rearview mirror, what is the city's plan to keep the same energy to fight the continuing HIV epidemic that largely and disproportionately impacts blacks in the district? There's a perception among some HIV activists in the city that since COVID came into being, HIV has been pushed to the side. Is this true?
It's not. We actually did more. We created these test-at-home kits that people could order. We ramped up our efforts with pre-exposure prophylaxis, meaning individuals before you're exposed to HIV. It helps you prevent the infection. We started a new initiative for post-exposure prophylaxis. So if you have an interaction, whether it be a sexual encounter or a needle stick or anything where you believe you've been exposed to HIV, we now have a program that runs 7 days a week, 24/7, 365 to help get you information about that. And we've also continued with our same, again, as I mentioned, health investments around that. So I'm going to take this a little bit broader than HIV, is that we recognize that the district needs a post-pandemic framework for how our health will recover from this, right? So we have folks who have not gone to the doctor in 16, 17 months because they didn't want to accidentally sit next to someone who had COVID and be exposed. We have people who delayed some of their preventive care. Dr. Newman already mentioned the shots, but people were delaying mammograms and colonoscopies during the pandemic. And so we're going to have a very intentional focus on how we make sure that we are in a better place post-pandemic in terms of the number of people who are getting those services. So you'll see a big push from us. Now, we wrote the plan and we wrote the framework. You'll be able to see it, I believe, next week. But we can't implement it by ourselves at the health department. So it requires all of our stakeholders in health and healthcare, and it requires all our community organizations to help people be able to understand how to manage their health and navigate their health. So we're thinking about this. We're ready for it. We've got the framework. There were a lot of lessons learned during COVID-19 that we believe can be implemented and put our public health and healthcare system in a much better place moving forward.
James, I think that's a really important observation by the questioner, and like Dr. Nesbitt, you know, we're thinking about what it means as we and all the things that we've learned through the pandemic. It's been fascinating in a way, just amazing in terms of public health. We've hardly had any cases of flu at Children's Hospital. We've hardly had any cases of a really serious virus that kills children called respiratory syncytial virus, RSV. Hardly any of that. The rates of asthma attacks are way down. And all of this is actually because of good public health. People are wearing masks, the kids are apart. Sadly, they're not in school. But what's going to happen when they're back together? And we're already starting to see things tick up. But our emergency department's been half full because of these kinds of things. But when you think about the fall, so now you start having kids with regular colds, with flu, with RSV, and you're trying to separate that out now from the pandemic virus. It's going to be very confusing, and we can't lose sight of things that we know how to take care of, whether it's HIV or these other viruses. So, you know, like I said, declaring victory is not the right thing. We can be happy, but we've got an intense amount of work to do to maintain the gains that we've made before the pandemic and even through the pandemic, as Dr. Nesbitt pointed out.
And I'd like to add really quickly that our Center for Infectious Disease Management and Research has never been busier. And this is one of the areas where we take care of patients who have HIV or newly HIV positive. Additionally, the primary care practices are very busy now with folks coming back into the hospital and into the practices, getting their primary care services and their screening services. One last thing I meant to mention as you talked about the children, the university will also mandate that all of our students coming back into campus are required to be vaccinated. So just to continue to support that effort.
So I don't know what our time is like, and with these questions, which I think they're all great questions. So what I might do is just run through a couple, and then if I can get just one person to answer, and then we might be able to get them all done. But speaking of children, Dr. Newman, someone asked, why should young children receive the vaccine if every 6 to 12 months, you know, they already have to get, vaccines are already being administered, and will the vaccine clash with the vaccines that you mentioned that they already need to get for school and other purposes?
I think that last question is very important, and I know you said only one person gets to do it, but I'm going to ask the expert, Dr. Nesbitt. One of the things we worry about, and I think eventually there will be probably a scenario where we have to get boosters particularly if the vaccine if the virus has variants and things like we do with the flu. But I think right now we want to keep things separate because you don't want to get the side effects, if there are side effects of getting the COVID vaccine mixed up with the issues of the vaccine that we've had a lot of time with over the years. So it will need to be separate administration of those vaccines. And we hope that we'll be having the COVID vaccine for the children under 12, but that the studies will be done by the fall. But it's looking like it may be deep into the fall to get all of the results back for that. And the important thing to get those young people, I think Dr. Fauci talked it through, was to you don't want to get confused. These kids can get sick. We've had some very, very sick children in the hospital. Almost all of them have recovered, but and then also they can be carriers and spread it to other people. So I think we all want to have that assurance that everybody's protected.
Two quick questions. Boosters. Will we need to get a booster shot in terms of those of us who have been vaccinated? The second is from a colleague of mine at the Informer, and she just wants to know basically, there's this perception that when you get a vaccination, it'll create a new illness that that has to be dealt with. Is that true or not true?
It's not true. There are some rare conditions, extremely rare conditions that happen with some vaccines. Some people often think about Guillain-Barré syndrome when you get an influenza vaccine. We've talked very openly about the very rare occurrence of a blood clot in the head with Johnson & Johnson, but those things are still extremely rare, and the benefits outweigh the risk with those vaccines. In terms of boosters, there's two ways to think about boosters. So when we get these vaccines, I've told you about antibodies. So when we get these vaccines, the number of antibodies we produce goes up, and it gets high enough that if the virus comes to us or we're exposed to it, we can fight it off. There are some vaccines that you get that the number of antibodies start to go down. And so the booster we think about is the same vaccine you got before, but the antibodies went down, so you need a boost to make them go back up high again so you can protect it, which is different than an annual vaccine. So when we get an annual influenza vaccine, what's in the vaccine in terms of what antibodies it's telling you to produce are different every year, right? So let's make sure that when we're talking about boosters versus an annual shot, those could be two very different things. Neither one of them are a bad thing to have to do. Again, we're still learning as we observe what these vaccines are like out in the real world. What I will emphasize is that if we don't get more people vaccinated who are eligible for vaccination, we run the risk even more of having more variants coming into our community and almost guaranteeing that this could be an annual thing that we have to do.
I hate to ask for one-word answers, but I just want to get... So one person wants to know if a healthcare worker refuses to get the vaccine, will they lose their job?
So I will say
I guess that's not a one-word answer.
I'm sorry.
I'll say if it's not for a religious or other moral reason, yes.
Okay. And then I feel I have to pull this one out. This person is the grandmother of 11 grandchildren, and they want to know what will happen to their grandchildren if they refuse to get the vaccine.
So, in the district, we do have requirements for school entry, vaccination for school entry. In the DC Health, just like me, I currently sit in that seat, make recommendations for what should be included in those recommended or required, not recommended, vaccines for school. And the only way that you don't have to meet that requirement is with a medical or religious exemption. And the medical exemption actually comes from your clinician. Because we don't have the vaccines available for children under 12, we have not yet made the recommendation to make it required, but all of our communication with our education partners really emphasizes that the best way that we get back to school and stay in school with avoiding outbreaks is to have all of our children who are age eligible for vaccination be vaccinated by the time they return late summer, early fall.
Dr. Nesbitt, I'm having this vision of this grandmother with these 11 children in her house, but that may not be the case. But because you are sending healthcare workers out, going door to door, if that grandmother was interested in having someone come to the house to talk to the children about the importance of the vaccine, is that possible?
Absolutely. So we have, yesterday, the mayor and I had a great opportunity to introduce the community to 7 community-based organizations that are well-trusted, well-respected here in D.C. Many of them are here today. And they have collectively hired 150 people who will be canvassing our neighborhoods, who will be in high-touch areas, barbershops, beauty salons, restaurants, faith-based organizations, to be able to deliver that type of messaging and to answer the questions. And they'll also be able to direct people to one of the over 100 locations in the District of Columbia where you can get a vaccine. You hear people talk about everybody in the country is 5 minutes away. We're less than that in D.C. In terms of a place for you to get a vaccine. So they're going to be able to give folks all of that information. And again, there's 150 of them. So they're going to be out, and you will absolutely have the opportunity to engage with them.
Thank you. James?
Okay. Dr. Nesbitt, unfortunately, some of my colleagues in the press have questions, and for both of you all, too. So any members of the press here?
Going once, going twice. Oh, yes, is that? Well, yeah, we have audience questions on these cards, and I don't know, did you fill out one of these cards? And we haven't answered your question? Well, I don't mind if no one else minds. Go ahead, what is your question? Yes.
Stand up, please. Stand up, please.
So, it's an excellent question, and I see my colleague here, Linda, who's running the mayor's gun violence prevention program and Building Blocks initiative, and they earlier this week also announced a tremendous investment in violence prevention in the District of Columbia. For folks who, what you're raising is a much bigger issue. It's people who don't see themselves as living for a very long time. And they take a lot of risk with everything. They take risks with their health. They take risks with their economic opportunities and educational opportunities. And we've been intentional since the creation of Safer, Stronger to be able to help shift the mindset for people to be able to understand that we expect every person in D.C., whether they were born here or moved here, to have a future and to think in a future-oriented way. And so just as we want people who believe that they live in neighborhoods where violence and crime is high and they're not going to live past 20, 25 years old, we want to shift that thinking by demonstrating that that does not have to happen. That is not your destiny. And in the same vein, getting COVID does not have to be your destiny, okay? We have a vaccine that can prevent it, and you don't know how the virus is going to perform in your body. So we don't want any young person thinking that I'm young, I'm healthy, it's not going to hurt me. We're seeing more and more young people have more severe illness where they end up on ventilators, and that's not something that anybody should want to experience as well. But you're speaking to the need to have a holistic approach to health, which we absolutely do.
And how are you, Dr. Nesbitt, all three of you actually, reaching out to Hispanic communities, especially those who believe in theories that involve religion?
So another shout out. Jackie Reyes is here. And if you all don't know Jackie Reyes, the director of the Mayor's Office on Latino Affairs, you are missing out on interacting with one of the most dynamic people on our team in the government. Jackie has been remarkable. Of the 7 organizations that are participating in the community outreach efforts as part of the DC's Community Core, Latin American Youth Center is one of them. And they've also been involved in a scientific advisory committee that we created at DC Health back in the fall. So we've had focus groups with our Latinx community. We've had very special pop-up vaccine events for them. One of them is Sacred Heart has probably been the most successful pop-up vaccine event that we've had. So we've got a very intentional focus. We communicate in all the 7 major languages of the District of Columbia for our residents. So we're not leaving anyone behind here.
So the last question I'll ask, because, and this is personal, because my husband who is here and I almost got a divorce over this one. And it's...
Don't leave like it!
It's wear the mask, don't wear the mask. When you wear the mask, when you don't wear the mask. What is the rule now with regards to the mask?
Who was on which side on that?
He had on the mask, so I think
I said take it off, but anyway.
So, we have tremendous confidence in these vaccines. If you're fully vaccinated, your risk of getting the virus is low in any setting. And so we have made it clear, district policy is that you don't have to wear a mask when you're indoors. Now, you have to follow the rules of the establishment. So if their rules are that, you want to make sure you're adhering to them and not having any challenges. But for fully vaccinated people, your vaccine is protecting you. You can drop the mask. For folks who are not vaccinated, you are still at risk, okay? You are still at a huge risk of getting exposed to COVID-19, and that's not restricted to age. So I'm not just talking about seniors who are not vaccinated. I'm talking about young people who are not vaccinated. So you want to be mindful to wear a mask when you're indoors. And while you don't have to wear one when you're outdoors, you do if you're going to be around a group of people whose vaccination status is mixed, right? So that's the best way to protect yourself. But I know a lot of fully vaccinated folks, we've been wearing masks now for well over a year. It's hard to let go. Do what you feel comfortable. And we're not going to be a mask shaming town, okay? We're going to let people do what they feel comfortable doing. So I know there's still a lot of fully vaccinated people who are wearing masks on their evening walk. And that's fine if that's what makes you feel comfortable and safe.
All right. I think that's it. Mayor Bowser? You done? Well, so much for coming. And thank you all panelists for being with us.
Thank you.
Well, thank you, everybody. Let's give James and Denise a big round of applause from the Washington Informer. And I have to say, my expectations are always very high, but this discussion has exceeded all of them. So please give a round of applause to the panelists as well. Now, the folks in the green vest, if you're moving, please stop. If you're moving, please stop. Okay, because we had a fantastic opportunity today. I want to thank my team for pulling everybody together because we have hired, like Dr. Nesbitt said, 150 fantastic people. And the fact that this program was in the works today is very good because you got to hear firsthand from experts who have heard every question about this vaccine to give you some tips, a toolkit to use when we're talking to our neighbors and friends. So again, thank you, everybody. Knock on a lot of doors, talk to a lot of DC residents, and let's get back to life. DC is open.